Have you experienced something that's changed you drastically, whether it's physically or emotionally? Maybe you can't sleep at night because you're thinking of things that you've experienced, or you have nightmares, or maybe you're just very, very sensitive to other people because of things that you've experienced. If this is something you can relate to, then this video might be for you. But first, allow me to introduce myself. I am Reynolda Jones, and I am the CEO and lead therapist here at A Solution B, located in the greater Grand Rapids, Michigan area. I specialize in working with women who've experienced high anxiety, high stress, and trauma. So welcome, and thank you for following me. And if you're new to this channel, I appreciate your support. And if you have been following my channel, thank you for the continued support. Make sure to like, subscribe, and follow. Leave a comment if you have questions or you just want to hear more information below. Trauma is defined as an emotional response to a distressful event, such as experiencing a possible threat of death, violence, or a serious injury. However, trauma does not always include violence. For instance, experiencing abandonment, not having your emotional needs met, or experiencing food insecurity can also be forms of trauma. Despite trauma being identified as an emotional response, recent studies reveal traumatic experiences produce physical changes in the brain, and it may activate discomforting sensations in the body. There are three types of trauma. First is acute trauma, the next is chronic trauma, and the other is complex trauma. Acute trauma refers to a traumatic event that has occurred due to a single event. For instance, acute trauma can come in the form of a car accident. Chronic trauma refers to experiencing or witnessing prolonged trauma for a significant amount of time. Usually, domestic violence is an example of chronic trauma. And complex trauma is experiencing or witnessing multiple traumatic experiences. This can include distressful events that are similar or a variety of emotionally painful events. For example, complex trauma would be experiencing a robbery, a car accident, and later witnessing a friend being physically harmed. Acute stress disorder occurs when a person experiences symptoms similar to post-traumatic stress disorder within the first month of experiencing a traumatic event. For an individual to be diagnosed with PTSD or post-traumatic stress disorder, a person must have experienced a traumatic event or witnessed a traumatic event, or had repeated exposure to a traumatic event, which may include hearing graphic details of an occurrence. With PTSD, emotional responses to these adverse experiences are often long-term, lasting beyond the first month of the traumatic event. Just a side note, a person can experience PTSD even if they have never had initial symptoms right after the event. But a person can also experience acute stress disorder for 1 month, followed by ongoing PTSD. Here are a few signs related to acute stress disorder and PTSD. Having anxiety, a low mood, hypervigilance, meaning easily startled, difficulty going to sleep, sleep disturbances, including nightmares, having poor concentration, recurrent dreams or flashbacks, zoning out, having negative thoughts about yourself or other people and the world around you, avoidance to things that remind you of what has happened to you, and irritability. And then there's even more of a list. So I'll put down a link to Mayo Clinic, which I love to use for some individuals. Symptoms may be minimal until they experience a trigger, such as a holiday event. And this is when it's best to explore the 5 tips to survive the holidays, where you can develop a plan to deal with people, places, or things that trigger you. Many individuals who experience trauma often experience suicidal thoughts or thoughts of unaliving themselves. And if you are experiencing these types of thoughts, getting support can benefit you. Again, a Mayo Clinic has provided following resources to seek support, like reaching out to a close friend or loved one, contacting your minister or a spiritual leader or someone that's in your faith community if you have one, calling the National Suicide Prevention Lifeline, which is 988, or reaching out to a trained counselor. You can also make an appointment with your doctor or a mental health professional. Other resources that I like to provide to my clients and people in my life is texting the crisis text line by texting 741-741. Again, seeking a mental health professional who's knowledgeable of trauma-informed care. And if you're currently counseling at a mental health agency or private practice, ask if they have an on-call contact number or after-hours lines for clients. And if you are employed, ask your employer if they have an employee assistance program, also known as an EAP, where you can obtain several free counseling sessions. If you feel you cannot maintain your safety, please visit the nearest hospital to get more immediate support. Here's the good news. Since you've been listening to this video, or maybe you even read my blog article about what is trauma, you have come to a very good place where you can start working on your healing journey today. Put a disclaimer out there that the tools provided in this blog article or video, or even in the captions below, are not to be substituted as professional assistance. However, the tools may be an excellent complement to your treatment when experiencing emotional distress. So one skill you may be able to utilize is the Stop for Distress Tolerance skill to help challenge negative talk using positive affirmations to heal childhood trauma, and it can be a source of empowerment. Experiencing PTSD can be exhausting, and at times you may feel alone. It may be valuable to hear another person's story of how they overcame trauma symptoms. Lastly, we are often hard on ourselves, especially when we feel as though we do not have control of every aspect of our being. And when this expectation does not match our reality, we question if we're crazy or blame ourselves, or we become hesitant to seek counseling. It's important for you to know that counseling is for everyone. You don't have to be crazy to engage in counseling. Let's summarize this video. Trauma is a distressing event one may experience, and each individual is different. Some people develop acute stress disorder symptoms within the first month of experiencing a traumatic event, while others may develop post-traumatic stress disorder more than a month after the traumatic event. Due to the complexity of the human brain and body, medical professionals aren't entirely sure why some individuals develop acute stress disorder or post-traumatic stress disorder, while other people may not develop symptoms related to trauma. But if you're experiencing symptoms that are interfering with your daily functioning and daily interactions, or having thoughts of harming yourself, it's best to obtain support sooner rather than later. There are many resources available to support you in the healing journey, such as the crisis text line, your spiritual community, and even the National Suicide Prevention Lifeline in English or Spanish. And there's also a number for veterans as well. If you're already engaging in counseling services, be sure to ask your therapist if there's an after-hours crisis line that may be used for additional support. There's an abundance of resources for mental health support. With that said, if you have any resources that have been a support for you, be sure to note those in the comments below, because I love to share them. Thank you for joining me again today. And I'll put down the links of all those resources in the comment section or description box, depending on if you are following me on my different social media outlets. Until next time, bye-bye.